Hey everyone, we're going to talk just a little bit, well, I guess I'm going to talk just a little bit about part of our chapter on consciousness. And part of the chapter talks about psychoactive drugs, which I think is an interesting topic. And so what we're talking about here are drugs that change consciousness. And these are usually things that interact with our neurotransmitters and receptors or neurons in our brain. So we're not going to be talking so much about like blood pressure medication or diabetes medication, but ones that will kind of change the way you think or see the world. um, I'm not going to spend a whole lot of time on this, but you will want to look at it for the exam. Your book talks about how some drugs are agonists and some are antagonists. You have to imagine that in your brain there are neurotransmitters that are naturally occurring. Okay, so our brain just makes these things and they have some kind of effect on us. If you take a drug that is an agonist, it acts like a normal neurotransmitter and it may have the similar effect. Okay, so an agonist is a drug that acts like something our body makes normally. An antagonist is a drug that blocks a receptor site so a neurotransmitter can't get there. Like the classic example of that is an antihistamine. So if any of you are like me and have really bad allergies, you take an antihistamine. What that drug does is it occupies all these receptor sites where histamine would go, and then it would make us sneeze and itchy. But since the spot is already occupied, the histamine can't get there. Okay, so read a little bit about that concept because I think there's a test question about it. There are varying levels of drug use. I usually have a much longer discussion about this in my in-person class, but I'll kind of go through this just a little bit with you. Um, Drug abuse is when someone is using a substance like alcohol or whatever, and it's starting to cause them problems. Maybe problems at work, problems in their relationships. Maybe they get a DUI, so problems with the legal system, something like that. Okay. The next level up would be psychological dependence. This is where you're spending a lot of time thinking about the substance or drug. And so the person might think, well, all right, I've got 4 beers in the fridge. That means I need to go and buy this many more. And I know that they're on sale at this place. And you're starting to spend a lot of time thinking about it. And then kind of the next level up is physical dependence, or what we commonly call addiction. This is where your body needs the substance just to maintain a normal level of functioning. And if you don't have the drug and you're physically dependent, you'll go through withdrawal, which usually involves symptoms that are the opposite of what the drug did for you. So, for example, a drug like heroin makes you feel very euphoric and just very kind of on top of the world. And if you're withdrawing from heroin, you essentially have a horrible case of the flu with vomiting and fever and all kinds of things. So it's kind of the opposite effect. Um, Physical dependence also comes with tolerance. This means that a person needs more and more of the drug or substance to get the same effect that they used to get. Okay, so for people who are kind of alcoholics, usually it started small. They only needed a couple beers and they were feeling kind of drunk. And now they can drink like 30 beers at a time and they still now are just feeling kind of drunk. And so they need more just to get the same effect that they used to have. Okay, I'm just going to talk about a few classes of drugs really quickly. Um, One class of drugs is a central nervous system depressant. The most classic example of this is alcohol, but also things like barbiturates or other kind of medications like that can work. So this is working on your brain and spinal cord, and um, this it's a depressant. So what it does is it slows down your activity in your brain. Um, and so remember when we talked uh, about the brain, we talked about the frontal lobe being the part of the brain that um, is used in like planning and thinking about consequences. Well, as you start to consume alcohol, at first you won't feel depressed. You might feel a little giddy because your inhibitions have come down a little bit, right? But then if you continue to drink, that depressant effect will come in. It starts to slow down the activity in your brain. And this is why when someone has had a lot of alcohol, they kind of stumble around and their speech gets really slurry. Um, that's because their neurons are not firing as fast as they normally do. There are central nervous system stimulant drugs, uh, and like the name sounds, this speeds up your central nervous system activity. So these are drugs like methamphetamine, cocaine, in a more legal sense, caffeine, which I drink a lot of, and this will make the activity in your brain quicker. So you've probably seen movies where people are on cocaine and they're just talking very fast and their movements are really, really quick. That's because their central nervous system is really stimulated. Okay, and you probably feel the same way with caffeine. If you have, I don't drink Red Bull, but if you drink a Red Bull, you probably feel kind of a kick and a jolt for a short period of time. There are opiates. These are a very addictive group of drugs. Um, they're often used as pain medications if you go to the hospital. Um, they make you sleepy. And so these are things like morphine, heroin, codeine. You probably had Tylenol with codeine from the doctor at some point in your life. Um, and these are really addictive. Uh, and if you become addicted to these, they can start to damage your neurons to the point that they hardly function at all. So that's not a good thing. And then the last kind of group of drugs that your book talks about is hallucinogens. This starts to create a loss of contact with reality. The world starts to look different, okay? As they're also called psychedelic drugs. These are things like LSD. Um, if you go on YouTube, I don't have the link right in front of me, but if you go on YouTube and search for some old black and white videos of people that have taken LSD and then they're talking about their experience. It's really funny and kind of interesting. And they talk about how they can feel the light, they can taste it. It has a lot of really interesting, kind of strange effects. So that's just a real brief little video lecture on um, drugs. Excuse me. Like I said, look through your book in these areas for a little bit more information. But otherwise, I think that's about it.